Hello everyone, it's Alexander here from the Youth Health Advocate Program and LGBTQ Drop-In. And today, as the video says, we are going to be talking about anti-discrimination laws for LGBTQ people here in the United States. We'll be talking a little bit about, by state, and mostly about New York because that's where we are. But if you have any questions about anything else, feel free to ask, and I will look it up because I have my computer right here. Just a little information before we get started on the actual meat of the live. I just want to talk a little bit about our program and what we do. So this is through the LGBTQ drop-in at Oswego County Opportunities. Normally we have our program Wednesdays at our Hillside location, which is 9 4th Ave in Oswego, New York. We have programming 4:30 to 7:30 every night. And when program's in session, we have snacks, we have arts and crafts, we have video games, all of that kind of fun stuff. So hopefully we can get back to that soon, because I really miss seeing you all, and I miss hanging out with y'all. Sorry, my cat was chewing on something. So that's what we have. We have our LGBTQ drop-in. We also have our Youth Health Advocate Program, which is what I work in. Which is a program that specifically is for HIV navigation, prevention, and linkage services. So we can connect people to testing, PrEP, anything related to sexual health, anything HIV related, free condoms, free condom delivery. And we also have some people from family planning and TPP that work at our LGBTQ drop-in or, guest star in the lives or at our meetings. Which focus on, as it is, teen pregnancy prevention, so birth control, getting connected to emergency contraceptives, free condoms as well, connecting to people to the reproductive health centers, all of that good kind of stuff. So that is what we have here at OCO, our health education services. So I'm just going to go right into the presentation. If you want me to stop or slow down, you can go ahead and let me know. I'm going to do this as casually and as, non-politically affiliated as I can. I'm just going to state the facts and what they are and what it protects you from. And if you have any questions, again, drop it in the comments. If I don't know it, I can easily look it up. I have my computer right here. If it's a harder question, I can look into it more and, help you all out and just send it to you afterwards. Okay, so I worked on a bunch of this today and days prior. So I've got a bunch of pages of stuff I want to talk about. So, of course, there are a lot of anti-discrimination laws in general. There are a lot of laws that pertain to LGBTQ people in general. But I'm going to be going over only a few of what we have, just because there's so many and there's so much, kind of language behind it and, expectations and all of that stuff that really is the meat of the actual laws. So I'm going to do my best and just go over what I have. So the first thing I want to talk about is the new federal law that just passed this past week that protects LGBTQ workers from discrimination. So specifically, it protects them from being terminated due to being LGBTQ, which is really awesome because that is a federal law. So all states have to abide by it. It's a huge win. Like I said, all states must adhere to it. So that's awesome. So you cannot be fired based on your LGBTQ identity nowadays, which is really awesome because, that was a huge thing for people in the South and the Midwest where they did not have those kind of protections, where, states like New York and California did have those protections for a while now. So that is awesome, but we also have to think about the conditions behind that law and how at-will employment is still legal. And what at-will employment means, it means that an employer can fire a employee at will at any time. It could be for any reason that is not, illegal discrimination or without reason. So, for an example, maybe you are a trans woman working in a fast food place and your boss comes up to you and says, listen, like you missed a spot while mopping last night, or your services are no longer needed, or that you're not good with the team, which is like completely, you feel like it is completely wrong. It's kind of silly, kind of small. So at will employment means that employees can still be discriminated against just for like small happenings. So could get fired, instantly just for like missing a spot while mopping. So that is something that, people still deal with. And it is 100% absolutely legal. Employers can just fire employees at any time as long as it is not, outwardly discrimination. So that is something that, still needs to be passed because even though it is illegal to fire somebody that is LGBTQ, beforehand it was like, say you are a trans person working in childcare, a lot of people feel as if LGBTQ people should not work in childcare. And let's say you live in the state of Montana, which didn't have any kind of protective laws at all for LGBTQ people. They could just fire you just for being trans. They'd be like, you're trans and that is not appropriate to be around children. So that would be their reason, and that would be completely legal until now. But, with at-will employment, they could still say something like, you're not fit to work for children, and that is completely legal without bringing up the fact that you're LGBTQ, but, they could still be discriminating against you and, feel as if you are not appropriate for the workplace without outwardly saying it. So at-will employment is still an issue for LGBTQ people. It's one of the criticisms that this new law has faced. There is no discrimination protection for LGBTQ people as long as at-will employment is still legal. At-will employment also protects employees of, quitting anytime they want. So you can quit anytime you want, and it's completely legal. Your employers cannot say that you have to stay or you have to put in a 2-week notice, although it is, a formality to put in a 2-week notice. You don't have to do it, but it is covered under at-will employment. So that's something important to take notice. You can always look up more about at-will employment. It's just something to get, knowledge about. Let's see. Okay, so we have that one covered. So there was another law passed, another federal law passed about a week ago, a week and a few days ago. So this one is a new federal law, which means all states have to abide by it. No longer recognizes gender identity as an avenue for sex discrimination in healthcare. So during the so this is really what it is an appeal of an Obama-era affordable healthcare law that protected gender identity under sex discrimination. So gender identity, the words, were protected under the language of sex discrimination. So what it really was is not a new law that's specifically against trans people. It's specifically changing the language of the law, which is what they say it is, but it is very harmful to trans people and very harmful to trans people who do not have, discrimination laws in their states. So this is like opening a whole thing up for trans people, especially in the era of COVID and people seeking health care right now. So what it really means is this means that in states that don't already have trans health care protections, doctors, nurses, emergency room staff, mental health services, urgent care staff, and specialists, and anything else in the realm of healthcare can turn trans people away and not provide healthcare to them. So just based on the fact that they're trans, it is legal to discriminate and turn somebody away from healthcare or emergency services just because they are transgender, which is extremely harmful because, these people still need the services. If you walk into an emergency room, you still need to be taken care of. But, if you're a trans person and you walk into an emergency room, doctors can turn you away. Hello, Sarah. Welcome to our live. Right now, I'm just going over the new federal law that no longer recognizes gender identity as an avenue for sex discrimination in healthcare. So as I said, the federal government passed it off as a change in the language, and they were just cleaning up something from the Obama era. Um, but this will hurt many transgender people, especially those that are chronically ill, disabled, or affected by COVID-19. So this is extremely scary. States have come forth and passed protective laws for trans people in response, such as New York State. I'm sure California has as well, but for my knowledge, all I've seen is that New York State has specifically said trans people are protected under healthcare in this state. So, yeah. So I feel like more states will, follow New York's example and hopefully protect their trans citizens, because it's really important right now, especially in the era of COVID-19, which is now seeing another rise in patients affected, positive cases. So, everyone's affected by that. It's not a discriminatory disease. Okay, so a little bit more about healthcare, specifically insurance and such, because, before, trans discrimination was protected through this federal law, but now that law is just gone, so state protections are specifically only about health insurance most of the time, because health insurance is different state to state, so that is a bit tricky. So hopefully more states will pass actual protective anti-discrimination laws. So according to the Human Rights Campaign, transgender healthcare rights are split into 3 categories. Okay, so we have 1, states that ban insurance exclusions for transgender healthcare. So that is passed in 8 states. What that means is that if you have insurance in this state, then it cannot exclude transgender healthcare. Does that mean it has to cover it completely? No, that doesn't mean that top surgery or bottom surgery or testosterone or hormone replacement therapy is completely covered. It just means that insurance will not deny covering some of it. So that is protective in 8 states. Number 2, provides transgender inclusive health benefits for the state. I wish I could read what I wrote. So basically for state insurance. So, state employees insurance, yes. So that is 1 state. So if you are a state employee, your transgender health is included in the state insurance benefits. That is in 1 state. And then there is number 3, states that include both. So states that ban insurance exclusions for transgender healthcare and states that provide transgender inclusive health benefits for state employees, that is covered by 13 states. So there are 28 states with absolutely no transgender healthcare protection in, the realm of discrimination, the realm of insurance protection, the realm of insurance coverage. So absolutely nothing at all. So yeah, that is all really important stuff, and that really has to do a lot with like healthcare and health insurance, which is a huge topic. Health law is extremely has a lot of red tape and is very hard to navigate for the everyday person. It is important to note that these are not anti-discrimination laws. Doctors and providers can still discriminate if they want to, except in New York State now. It is also important to understand the difference in federal and state insurance. So this is very important because it will determine whether or not you are actually covered, if your insurance is required to cover your transgender health care. So that doesn't specifically mean if you're a transgender person and you're trying to get health care about, let's say, you're trying to get medication for, let's say you have a chronic illness. If you are trans and getting medication for your chronic illness, your insurance should cover your chronic illness just because that is not in the realm of transgender health. Transgender health specifically is, things like top surgery, bottom surgery, gender-affirming surgeries, hormone replacement therapy, all of that kind of stuff is going to be in the realm of transgender health, just to be specific. So some insurance companies are national companies. These are kind of like bigger companies, kind of like Aetna and stuff like that. If they are national companies, they adhere to federal law rather than state law. So this is something I've personally had to deal with, trying to get top surgery, and my insurance did not cover it. And, I didn't know until afterwards. So that was like a huge thing. And though I do live in New York State, the insurance company was a national company, and the employer that it was through sent claims to that company rather than filing claims themselves. So because they sent it to the company, it was included in the national kind of insurance claim. So because there are no protections to include or cover, transgender health in this kind of, in this national sense, my surgery was not covered at all. So even though I live in New York State, because it was a national ranked service, insurance, I was not covered at all. So that is something really tricky. And that's something you really, really have to look into, and you really have to research before you go about these things, because there's so much law and red tape surrounding these things, and it's really important that you get it figured out. Maybe you talk to a lawyer who can help you out. There is the Volunteer Lawyer Project in Onondaga County. They do help people with people in Oswego County as well, and surrounding counties. So that is something to look into if you're looking to get, your insurance to cover your transgender health care. That is something definitely look into. Okay, so next, we're going to go into kind of the next big thing that happened. So same-sex marriage became legal in 2015 on a federal level, which was extremely awesome, which is a huge win. But same-sex couples and LGBTQ people still face many issues. So just because you can finally get married as a same-sex couple, there are still some issues surrounding things such as like housing, protections overall, healthcare, all of that stuff. So yeah. So for the first example, we're going to talk about housing discrimination, because that's really important. Everyone needs somewhere to live. Just going to take a sip of water first. And again, if you have any questions or comments, please feel free to leave them in the comments below, and I will get to them, as they come. Let me check the time. Okay, 5:33. Okay, so in 22 states plus Washington, D.C., it is illegal to discriminate based on sexual orientation and gender identity in the realm of housing. So when I mean in the realm of housing, I mean buying a house, renting, or leasing, anything that has to do with, living somewhere. One state prohibits discrimination based on sexual orientation only, which is Wisconsin. So really, in Wisconsin, if you are gay, you will not be discriminated against on a legal level. But if you are trans, you can be discriminated against because you are trans. So that means 27 states do not protect LGBTQ people from housing discrimination at all, which is incredible. So that means LGBTQ people can be denied housing due to their sexual orientation or gender identity, even if they are legally married. So even if they have other legal protections, just because they have those does not mean they have access to these other protections, such as housing. And again, I want y'all to keep in mind that just because it is illegal to deny someone a service or housing, they can be the people selling housing or taking your rent, such as a landlord. They can be rude. They can be homophobic, transphobic. They can charge you weird fees that others may not have had to pay. Hide weird fees, and charge you a higher rent for some weird reason. But really what it comes down to is they're discriminating against you, and you need to keep an eye on that for, those weird things that don't seem quite right. So that's something you should look into a little bit, kind of go over some, history and some examples of housing discrimination and what that looks like. Of course, there are like a bunch of programs to kind of, protect people against that kind of housing discrimination where it's kind of those kind of hidden housing discriminations where they're, charging you extra or something. There are a bunch of programs to help you do that, help you find housing through people who are trustworthy, who will not discriminate against you. So yeah, there's always programs to help. Okay, so we are going to go into some of the protections we have specifically for LGBTQ youth because, I feel like most of you watching this, you're going to be youth, as this is a youth program. So first off, there is Title IX, which bans discrimination based on sex and protects students at schools with federal funding. So that includes public schools, such as high schools, middle schools, and elementary schools that are kind of just like open for anyone to go to. Those are the schools that collect public taxes, which are federal funding. But it does not include private schools, such as religious schools or private colleges. Those are not, protected by Title IX because a lot of them do not have public funding. Some states have anti-bullying laws as well, which differ from Title IX funding. So there are anti-bullying laws, and then there's Title IX, which protects against discrimination. Okay, so this anti-bullying law only calls the schools to address bullying based on LGBTQ identities, not necessarily do anything about it. So a lot of them, they have to address that it's happening. They have to have statistical data on it, but it does not mean that, things have to be done. That's just something to keep in mind. So 22 states are required to address harassment and or bullying of students based on sexual orientation and gender identity. 7 states restrict the inclusion of LGBTQ topics in schools. These are mostly states in the South and Midwest. In these states, it is, basically illegal to talk about LGBTQ topics, to even acknowledge that they're real, acknowledge that people are discriminated against because of them, just not talk about it at all. And in 2 states, prevent schools from specifically protecting LGBTQ students. So there are 2 states. I wish I wrote down which ones. I'm pretty sure one of them is Texas. I remember that. 2 states prevent schools from specifically protecting LGBTQ students. So in these states, these schools cannot, 1, promote that LGBTQ students are, 1, real, can't talk about topics, can't talk about LGBTQ history, but they specifically cannot protect these students from bullying. If a student is being bullied for being LGBTQ, that's just that. They can't do anything about it, which is, that's rough. It's amazing. So many times, LGBTQ bullying comes off as overlooked or swept under the rug a lot of the time, or just not acknowledged at all, which is just awful. So yeah, when, LGBTQ kids say they don't feel included in high school, in like school or middle school or anything like that, they're being honest. A lot of these places are, awful. And in these 22 states that are required to address harassment, they're not that great at it either. There are a lot of, rural places in every state, a lot of rural places in upstate New York, as y'all know, that, don't take bullying as seriously as they should, specifically LGBTQ bullying. Of course, they address it with students and, say, this is not okay, but they don't really stop it a lot of the time. They don't really address it in a way that is productive. So yeah, that is something that definitely needs to change. I'm sure there are petitions and stuff like that out there. Call your representatives and talk about it. That definitely needs to change, So next and lastly, so we have one more thing. I'm going to talk about conversion therapy laws. So conversion therapy is specifically a pseudoscientific, and pseudoscientific is just a big word for fake science, practice of trying to change an individual's LGBTQ identity to cisgender and or heterosexual, depending on how they identify. So really making gay kids straight. People really think that can happen. There were a lot of experiments in the 50s and 60s with gay men specifically, and converting them to heterosexual through electroshock therapy, and kind of like that, pain therapy, and just trying to condition them to be straight. Which is just awful. It did not work. It didn't work most of the time. And the times it did work was mostly just gaslighting and traumatizing the patient. So, and many people who underwent conversion therapy and quote unquote became straight ended up taking their own lives because it was just, they were not happy and it was just awful. Okay, so like I said, conversion therapy is traumatic and extremely harmful for those that go through it. It is banned in 20 states and DC. So I said banned like this, as in licensed mental health providers cannot practice in conversion therapy, but many LGBTQ youth still deal with conversion therapy, even in the protected states, because it only bans it in a professional level. So if you are a licensed counselor, you cannot legally practice conversion therapy under these 20 states if the patient is under 18. Now, if somebody who is over 18 comes and they want conversion therapy, they can practice it just fine if that's what they are licensed in. So yeah. And in New York State, if you want to go through conversion therapy, it is not included in state insurance. So you'd have to pay for it out of pocket or go through a national insurance that would cover it. Okay. So a lot of the time, youth in religious communities still undergo conversion therapy quite often because it is, one, not documented. A lot of this is in secrecy. Two, against their consent, their parents send them, their youth pastors, their normal pastors will send them to conversion therapy, or, a lot of places of religion will do it themselves. And three, not a professional mental health level, which is what is banned. So, one, if this isn't being documented, and two, if it's not by a licensed mental health professional, it is still, technically legal. It's still happening, which is awful. Like I said, also note that people over 18 can go to conversion therapy at any time if they'd like. And conversion therapy is a lot different nowadays. It's a lot of, kind of like gaslighting, which just means, kind of, telling you something else than you know or you feel, someone telling you that things are different even though they feel correct. Just kind of just like an abusive tactic. There is a physical abuse aspect to it as well, and it's just very traumatizing and it's very hurtful, and it's something that still happens, and it's only banned on a professional level in 20 states. So there are 30 states where it's not banned at all, and it's completely okay to send your kids to conversion therapy, which is awful. So again, there are always petitions and stuff going on around that stuff. Research it a little more, get a little more knowledge on it. So yeah, that's all I have for you today. So again, I didn't go over every law in the United States, anti-discrimination or LGBTQ law or anything like that, because there are a lot, and I tried to go down into these ones that I picked and kind of, bring it to a different level and kind of, pull it apart, unpack it a bit, and kind of talk about it. So, of course, anti-discrimination laws are great, and of course, laws that protect LGBTQ people are great, but we have to remember that there are a lot of ways that people can still get around these laws. There are a lot of ways in which, health insurance can get around these laws. And it's just best to research it. If you feel like you've been discriminated against or you feel like something is wrong, definitely research it. You can reach out to me or anyone else and we can help you. So yeah, luckily we live in New York State, and that's probably one of the best places, one of the best states to live in if you are LGBTQ. Of course, we still have a long way to go. There are still a lot of things that need to be passed, a lot of, things that LGBTQ people need to reach the same equality as, straight and cisgender people. So yeah, hopefully within the next few years, we will see more laws being passed on a federal level, so everybody can be included in these. And yeah, I just hope we can get what we need and that everybody can be protected and stay healthy and happy. So I hope everybody has a good night, and I really appreciate you coming onto my live. I hope you had a fun time. I did. I just talked the whole time, but that's okay. I hope you enjoyed it. Again, if you ever need anything, if you want to talk further about what I presented today, feel free to message me. You can message me at Alexander DeSacia, OCO. You can also message the LGBTQ drop-in page or the Youth Health Advocate Program page. I hope you all have a wonderful night, and I will see you next week, or maybe sometime this week.